economic outcomes and take a look at, where we're trending, where we've improved, where we are working on things. And so I just want to express appreciation to the group in the room for continuing to walk through all this information and work on incentives and ways to really get people to care and get people to better outcomes. And also want to thank everybody who's joining us online. We've got our usual quarterly report and information and things that we'll walk through. But we have special guests with us today to talk about some workforce specific improvements that the state is making. We might even touch on some of the larger ecosystem, work that's going on that's not really a thing yet, but it's a conversation. So I'm happy to chime in there if you want, Robert. But I'm just looking forward to, again, appreciate our healthcare plan partners and everybody who's here to walk through this information. So that is the extent of
Perfect.
what I think I'm here to do.
Yes.
So.
Perfect. I'm Nell Smith. I'm the Deputy Director of Division of Medical Services, and ARHOME is in my bucket. So this is, oops. Oh, there we go. So welcome to everybody. Just as a reminder, we've got folks in the room, and thank you guys for attending in person. And we also have folks joining via Zoom, and we thank you all for tuning in to make this a successful meeting. And a reminder that as per usual, Arkansas PBS is live streaming this meeting now. So hopefully you'll stick around in Zoom so that you could participate, ask a question if you need to, but also you could watch it later. The recording is in this link. And then all of the meeting materials will be on our website, the ARHOME website, after the meeting. So you can go and snuggle up and read all of the things that we may have talked too fast for you to get. So the meeting focus today is on increasing opportunities for economic independence. And just as a reminder, the ARHOME Act, the act that created ARHOME, listed as one of its intents, increasing opportunities for full-time work and attainment of economic independence, especially for certain young adults, to reduce long-term poverty that's associated with additional risk for disease and premature death. So the economic independence piece is integrally linked to ARHOME and a major focus. So that is sort of the conversation for today. We have some other things to get to first. First is the ARHOME quarterly report. This is a legislatively required report. We have it here. It looks like this. It will also be online, and people in the room have hard copies of it. It is a lengthy report. There are a lot of things that we're required to put into that report, but I'm just going to go over a couple of things that are of particular note. Dennis is see all the documents. So this is an ongoing look at what has happened to the ARHOME enrollment following the end of the public health emergency. As you all may remember, we were required to not disenroll anyone from Medicaid during the PHE. Welcome, Elizabeth Pittman, Director of the Division of Medical Services. So you can see that we started disenrolling individuals who were no longer eligible in the beginning of April, and you can see there was a steep decline through September. September was when we completed all of the disenrollments, and you can see that since then we've continued to decline. 1 or 2%. In the months after. We're now at 237,976 people in June. That's a 32% decrease from our high of February, but it looks like we are beginning to level out in that disenrollment. welcome Mike Rogers. You're gonna need to sit close here. Let me scoot over. This is another slide from the quarterly report. This is to show you that we have a new QHP. Prior to 2024, we had 5 QHPs. We had 2 that were Blue Cross Blue Shield, and then 3 that were Centene plans. Now we have a new Blue Cross Blue Shield plan. It's called Octave, and it's currently at about 7% of the total enrollment. So the next thing we're going to talk about is the Arkansas Medicaid Sustainability Review. My notes are in here.
You might need those.
Oh, thank you. So the Medicaid Sustainability Review. Dennis is getting greedy with the paperwork. Is a report that was commissioned by I'm sorry, I should have done that. Commissioned by DHS to identify potential ways to address concerns. At any rate, a report to identify potential ways to address concerns about the steady increase in costs of operating the Medicaid program. So the issue was the cost of operating Medicaid increased 41% between 2018 and 2023, and Medicaid increased from 20% of state general revenue to 23%. So the review purpose, DHS contracted out for this work between March 2023 and March 2024, and the purpose was to examine options to improve the Medicaid program sustainability. DHS evaluated, or our contractors evaluated key program areas, including the PASS program, a managed care program that addresses folks with complex needs. They looked at pharmacy, they looked at our primary care case management program, and they looked at ARHOME. And the report focused on programmatic modifications to support sustainability, but did not look at provider rates. I think there's intention to do that at a different time, and did not review hospital services. So the report and the supporting data can be found at the link, which will be on our website. The link goes to our website, but this PowerPoint with the link will be on our website as well. We are talking about it today to make sure that we can take everyone's input, take comments until July 14th, 2024. And that is the email address that you would send said comment. We'll take comments any way that you guys want to send them. If you want to send them to me, Elizabeth, Chrissy, you can do that too. But that's the address, the specific address for those comments.
My copy out
Yes,
here for
please.
this. So the Medicaid sustainability, I like to make sure that we're clear on this every time it comes up. The purpose of it was to look at the sustainability of the program itself, also to look at outcomes, improvements in those outcomes, but there were no, so we continue to say everything is on the table, nothing is off the table, everything is up for consideration. But we also want to be really clear that the report is not recommendations, it contains options. And so it walks through all the different pieces of our Medicaid program, and it presents different options, and the options are organized in the report from the least disruptive to the most disruptive. I think I got that right. So, just sort of what the impact would be on the entire operating delivery system for Medicaid, with each of the different pieces of the programs, like long-term services and supports, pharmacy, PASS, non-emergency transportation, all the different pieces. So, we were not required to take public comment on this, but we felt like it was the best way to get the options out there. And it's also a really good way for people to provide input on things that maybe weren't considered as part of the report. So we're learning things as we go through the process. So just want to make that caveat. There's no
make others.
predestined, sort of decision and, nothing that's being discussed or decided behind closed doors. This is we want it to be a very transparent, open conversation. We are walking through each section of the report with legislators on an as needed and as we're available to do that basis, just so that we get their questions as well.
Perfect. So while the whole report deals with not all of the Medicaid programs, but many of the Medicaid programs, we're just going to be focusing on the ARHOME section of the report. And these are the options that are described in the report for ARHOME. And the first one is to retain the ARHOME QHP model. So as you all may know, ARHOME operates under a waiver, and that waiver allows us to purchase private health insurance, a QHP, for the individuals who are in the ARHOME program. So that is a very different model than many other states, all of the other states, in terms of being able to purchase private health insurance, and dealing with our expansion population in that way. So the first three are retain the model, but strengthen the controls. So just as an example, one is to make some adjustments to the MLR. That is a standard that says 80%, the health plans have to spend 80% of premium dollars on services, medical services provided. And that's a gross oversimplification. But so there may be, one of the options is to increase that not to 80, but to 81 or 82%. The other one is to set limits on QHP administrative costs. We currently have a budget cap for the ARHOME program that the QHPs can't exceed. This would be something similar, but on administrative costs themselves. So those are the strengthened controls. Number two is to shift some cost share dollars into premium dollars. So we have in our ARHOME program, the QHPs are 70% AV, actuarial value. They're silver level plans. That means that individuals in these plans, policyholders, pay about 30% of the overall costs of the plan. And they can pay those. Our clients don't pay 30% of the cost. DHS pays most of that 30%. But the 30% is made up of premium and cost sharing, like co-pays. So the QHPs set their premium rates based on an overall 70-30 split, but the needle could shift more to premium and less from cost sharing. The idea behind that would be that we would get, if it's shifted more on the premium side, then we would pick up 2.5% in premium tax dollars that goes along with that we don't get on the cost share side. So that's number two in a nutshell. Number three is to increase the hospital provider quality assurance fees. This is an idea to increase this quality assurance fee, which is now somewhere between 1.5 and 1.7% of net patient revenues. The state law allows us, federal regs allow us to go up to 6%. So there would be, the idea would be that there would be some increase in this hospital assessment that would then be shared would come to DHS for the operation of the program. So the next idea is to modify ARHOME auto assignment process to better control spending and reward QHP performance. So currently our auto assignment process is a round robin, basically a round robin. There's some market controls, but it's basically a round robin auto assignment. So when someone new comes to the program, they get a chance to choose their QHP. If they don't choose their QHP, they get auto assigned in this round robin process. I think the idea here is that if one QHP is performing better, we tilt the auto assignment in their favor, the auto assignment methodology in their favor. The third option here is to move our home beneficiaries to either a managed care process or traditional fee-for-service. So managed care operates somewhat similarly to a QHP, where we would be providing a capitation payment, one payment to an entity to take care of all of the services that that client needs. In the same way that we currently pay a premium to the QHPs to take care of all the services that the client needs. So one way to move individuals to managed care would be to put them in the existing program, the PASS program, which currently handles complex people with complex needs. The other managed care option is just create a separate managed care program separate from PASS. So those are the two managed care options. The third option is move all of the ARHOME beneficiaries back to traditional fee-for-service. That is where providers go back to billing Medicaid for ARHOME clients, and they are receiving Medicaid reimbursement rates for that service. That's a little wrap up of the Medicaid sustainability report. We're going to move on to the ARHOME economic independence incentives. So the requirements of the QHPs in 2022, the first year of ARHOME, the QHPs were required to offer one economic independence incentive. This is something that is, I think, I would guess is the hardest thing for the carriers, because they do health things. Getting into workforce and employment is a learning experience. So they were required to offer one economic independence in 2022 and two in 2023 and 2024. So these are, they could, you'll see examples of them here in a second. But the incentive purpose was to encourage advances in beneficiaries' economic status or employment prospects. And the QHPs also were required to include activities to support the Economic Independence Initiative in their annual strategic plans. So this is work that our friends at GDIT have done for us. ARHOME is a waiver program, and that means we have asked permission from the federal government to do things a little bit differently in the ARHOME program. And for permission to do things a little differently, we have to have an evaluation. We have to be able to evaluate whether what we're doing is effective. So these are survey questions that were mailed to our clients, our ARHOME clients, and it was this is part of that evaluation. There were health-related questions that we reviewed in December. And these are the economic independence incentive questions. So the first one shows that about 12.5%. Oh, I should say, I think you guys sent out to about 3,000, maybe more than 3,000 individuals. We got about 200, a little over 200 response. 2,000 sent out to 2,000. Had about 200 responses. So it's a lower response rate than what we were hoping for. But that was not for lack of trying. But these were the results from the people who responded. So 12.5% of people said that their health plan did offer them information on programs to help them get a job. That could have included career fairs, referrals, or programs to improve job skills. They also said that about 10% said that their health plan offered rewards to join programs to help them get a job, including job and career fairs or referrals to programs to improve job skills. And then 15% said that they knew that their health plan should promote programs to help them get a job as part of the ARHOME program. So those are pretty low awareness scores. We hope to improve those, and I think the QHPs are making sure that they're communicating, improving their incentives, and also communicating those out to members. So just, this is not new information. We reviewed this, I think, June of last year. You might have been here when we did this. This is the 2022 results from, just as a reminder, the Blue Cross and Blue Shield and Health Advantage Blue Cross plans asked for individuals to earn a Arkansas Career Readiness Certificate and send that certificate to Blue Cross for verification. That certificate is, to get that certificate, you have to take 3 ACT Work Keys assessments. And before that, there's a whole curriculum that somebody needs to take. It's a long process. And so there were only 2 people who took advantage of that in 2022. The Centene plans offered videos about encouraging savings, debt reduction, smart purchasing choices on their website, and had some more uptake of that. They were paying in terms of points, and folks could use that money towards things to buy on their portal, or could pay for monthly bills. So this is 2022. So then in 2023, again, we asked them to do 2 healthcare incentives, economic independence incentives. So you can see that Blue Cross continued with the Arkansas Career Readiness Certificate and had a little bit more uptake, 5 and 1. The first 2 numbers on the beneficiaries awarded, the top ones are related to the top bullet, and the ones on the bottom are related to the second bullet. So they have just a little bit more uptake of that one. Then they asked them, the other one, to complete a continuing ed class with an award of $25. And again, they had more uptake of that than they did of the career readiness certificate. Centene continued with their videos online. They also added a community health fair. They had 350 people who attended at the health fair. There was job searching and resume building available to anyone who attended that community health fair. The health fair could be attended by Centene members or anybody else. And they had 350 people who attended one of 4 health fairs. I'm assuming that the 350 couldn't be broken out by plan, because it included not only folks in these plans, but probably other Centene plans or me off the street. Yeah. So those are the results from 2023. And just as a reminder, these are what they're continuing to do in 2024. You can see that Blue Cross has increased the incentive amounts for the same 2 ideas, and Centene is planning the same for those. So with that information, I don't know if that changes anything that you want to say.
Get rid of.
So, I think you were at our June meeting last year.
I was.
And at that point, so Mike Rogers, Chief Workforce Officer, and Robert Magoo, Chief Data Officer, they were just beginning a whole bunch of work on trying to connect people to people and employers, and help people connect to services needed so that they could then go out and get employment. So we've asked them back. They're about to launch and civi form, and so we would love to know more about it.
Great. You want the tag team on this? You care if I start?
Go ahead.
Okay.
I can get us, you do the next slide. That might make a good backdrop for.
Yeah.
for the overview.
Give me this.
You know, from seeing the words sustainability, economic independence, all the different parts, the only one that makes me nervous is AETN. So I realize maybe I'm hiding in a good spot, but last year it was all about words. It was about strategy and vision and didn't have anything really to deliver. This year's different because we have been able to design, beta test, get some numbers, it's working, and we're ready to plug it in. So what I think the goal is for us is and I'm gonna go philosophical first. Workforce is not the problem. It is a symptom of a greater problem. It's a heart condition. It's a desire. It's cultural. So we're not treating it like a symptom. We're treating it more, or not like a root cause, more like a symptom. How do we serve whole people in Arkansas? And we can't do that by agency because we might have one person who's involved with Department of Corrections, that's involved with DHS, that's come through our education, all the different pieces and parts. So we're designing out a system, serves the whole person to increase awareness, exposure, because meaningful employment at a livable wage breaks cycles of poverty, incarceration, substance abuse, suicide, and a lot of different things that end up being factors that are dealt with in this agency. And so it's kind of a bilateral. One is to help identify services are available, streamline the process and lowering the frustration, both on a case manager and on the recipient of knowing how do I get what I need and serve those barriers. So that's a lot of what Robert has helped design. And we've got some really good numbers on integration of where we're at. The 400,000 from Medicaid, is that the right number that we may be trying to?
Well, 235.
It's 230.
Yeah, so how do we start to release this scalable to really serve the Arkansans that have a barrier? Those have one or two impediments that keep them from getting a job and guide them, either the employer to find the right talent or the Arkansan to find the right job. And so that's part of the work that we're doing through Launch, and Civiform being the common intake across the agencies on the workforce cabinet today, maybe enlarged to the whole governor's cabinet. But there's a lot of work coming together with NGOs and private philanthropy, employers that want to have the metrics, the dashboard, and know how to drive Arkansas to empowerment. Peg.
And we can just kind of get the solutions out there. That way we can talk about them and answer any questions. These are the first of a number of solutions, but they're all kind of built around the conversations we've had over the past 12 to 15 months. We started with user-centered design with the whole governor's workforce cabinet, and Mike's talked to a lot of employers and providers. We've really just tried to harness the collective wisdom of our state to kind of like design a system to efficiently connect residents with opportunities, particularly for economic independence, with be it employment, training, education, supportive services, and just take the friction out and make that as easy as possible. Governor Sanders named it Launch, that we will be launching Launch, and it has multiple personas. The first one that is available today, but has been in limited release to unemployment insurance claimants as an option, is called Launch for Job Seekers. The goal from Mike was 6 click simple, so we wanted to kind of look at each persona and keep from overwhelming people with too many things. This is what you see today if you go to launch.arkansas.gov, and we're ready to start bringing users onto this platform as soon as someone identifies that it may be beneficial for a resident.
What Robert and team have been able to do is to be specific to a person's situation, to make it customized to them, hide the noise, all the distractions, the bureaucracy, and get them to see themselves in the journey, and then reward them with 6-month intervals of how they can change their current status. And that's the exciting part about the piece that makes it smart and functional is it's custom to the person. And that way they can see what they need to see when they need to see it and remove all of the layers.
And maybe the easy way to think about this, to relate it back to other common technologies, is kind of like Netflix for your career. You've got the access to see everything, but the more you wish to disclose or provide, the better it's going to have recommendations. It provides very personalized recommendations to help cut through that noise. Because any given day, there may be 17,000 jobs on the platform, and we really want to kind of help someone with connect. as quickly and as seamlessly as possible. To help start providing that, we start with everyone does a skills and experience profile. And experience can be a post-secondary credential, a workforce non-credit credential, high school graduation, employment experience, volunteer experience, like anything that counts, for skill attainment, because we're really trying to get the skill. So as we do the experience, it's going to suggest skills. It's got a vocabulary of over 50,000 skills. So it's got to a place where it recognizes most skills. When someone puts in an occupation as they're putting in experience or a credential, it will suggest skills. And so in this case, like someone put in orderly and it suggested acute care, nursing, healthcare, and then they can add skills to that, and that's self-attested. But they can also put in verified credentials. We'll talk about that later. If someone goes in today, they're not going to see that add your experience from a wallet because we've got to get the publishing out. But we're working, at least for state-supported credentials, to publish digitally verified credentials. So the employer can have a signal of trust that, yes, this institution, this provider has signal to verify that you have these skills, you have this credential, which especially as people are starting to use ChatGPT and resumes and things like that, can really help like cut through the noise and connect with employers because they can search on these kind of validated signals of skills.
The quick start to that for me is that I can upload a resume and it builds my core skills. I can say yes or no, this really fits where I'm at. If I want to change from one job field to another field, it gives me something to start with today. Tomorrow, maybe I use this to create my new resume because I can't use usually the same resume for each job if I want to look across different sectors. So it helps to design that intuitively based on what I'm putting into it. But my situation that kind of caused some of these conversations was when I was an employer, somebody comes to me with a 20-year resume and I interview them, they don't have 20 years experience. They only have 1 year experience for 20 years. They've self-attested. I need something that shows me that they have a competency. If we can get to currency for workforce in Arkansas is what can I do and can I prove it? Regardless of where I learned how to do it. So if we can get to that currency, then we can start working across high school graduation to a GED or to higher ed, if it's a technical permit or an associate's, but I can start saying, yes, I know how to do it. Yes, I've demonstrated it and I can do that. So if we have that as a currency, then I can start to measure latency. Things like, yes, I saw that you could wire a switch, but I saw in the way that you did conflict resolution in your durable skill side. So how do we start to capture someone's capabilities and not just their education?
Everything's out of skills. So the first thing in the credential registry were the 22 certificates from the Arkansas Correctional School District. Those 22 credentials represent over 300 learning opportunities and 601 competencies. So it really breaks it down. If someone has an HVAC certificate from the Arkansas Correctional School District, what is it that they know and can do? And as far as like can read a tape measure, can climb a ladder, working with electrical concepts, because with that sort of skills transferability, there might not be a job that says like HVAC tech, but there are transferable skills, that can be relevant. So everything's working not just at the occupational work, down at the skills level.
Those were the struggles that I felt was important because if I had a certificate of proficiency, all that means is I owned a printer. It doesn't say I can do anything. So dialing this into competency, demonstration of skill, and having that validation becomes more like a license and a certificate. And that gets us to a place where it takes the burden off of the employer trying to find the right people or the skill set of the person looking for the right job, and it creates that match.
Yeah, skills experience, as we move in the future, we'll keep adding in interest, aptitude, with other things, company culture. But we started with skills as the most important part. But the next thing that it's going to take people to is exploring careers. And it's got a little card for every occupation. It has the name, a little video. It says the skills match, and there are a lot of different filters and searches to allow for someone to look at something, near them geographically, very similar to what they're doing, highest skill match, largest, wage gain. The filtering is based off of 10 years of Arkansas administrative data with algorithms at where we've seen successful career transitions leading to advancement in economic security. There's Arkansas-specific labor market information on average wages on demand. We can continue to add this here, and then links right there to jobs in that, training in that. And then there's the little thumbs up to save this. As someone records their preferences, that what they like, similar to Netflix, if they choose, it will give better recommendations. So it kind of learns them. All the videos are based on the pervasive just Department of Labor videos, which there's one for every occupation. So very comprehensive, not always very exciting, especially for the younger generation. So we have a group called Edge Factor that it does very high quality videos. It particularly resonate with the younger generation, and they are filming with Arkansas specific employers all over the state in all industries, filming higher quality, much more Arkansas relevant, much more timely career exploration content. And so as those become available, if we have an Arkansas specific video, that's what we'll see here. And there's a whole other series, deeper platform there that will have a button that they can drill into for additional career exploration and awareness. If they click through to a job, they'll see a similar kind of card view. They'll see different jobs. If it's available, they'll see the salary. They'll see the career path. They can filter in career path again. Lots of different ways that they can filter and look at it. It's designed to be personalized and get them there as quickly as possible. And they can go and visit the job posting currently. Like I say, it's about 17,000 jobs today. And if you click that, it goes directly to the applicant tracking system for the employers, which I think I've seen with Blue Cross jobs and for that. But anything that's coming today through the National Labor Exchange, all the same jobs are available in any American job center. And then there's a different additional option coming that we'll talk about in a minute. Going the other way. Not everybody gets a screen. And we didn't talk about, there's a similar recommendation thing for education and training programs to start in that. Today, it's a list of potentially relevant programs. And then as we get further in for launch for students, it'll be that stackable career pathway, how they can navigate and visually see their progress down a continuing education path. For clients that have some sort of interaction requirement or incentive, we have this piece here, and this is for unemployment insurance claimants. They have to complete a certain number of required work search activities a week. It used to be for an annual process for everyone involved. And so now, but because they're going and doing the work search on the system, we don't really need to ask anybody that again. It gives them a little dashboard, a visual indicator for each week of what is required, if they've completed everything. If they're just doing it through the system, they'll just know that they're covered and they're good and they're fine and certified. Or if they attend a job fair or do something that's outside of the system, there's an easy place to report that into the documentation. And then if we end up with multiple programs that all have similar activities, we might get to a place where they can do the reporting once and use it multiple places.
That's a quick question. If the QHPs wanted to incorporate some of this activity as an incentive, is there a way for them to be able to see who of their members have completed said activity?
Yes. It's technically possible. We have to get to the fine details of the governance, but that's the intent.
So
And you can see those metrics skyrocket because we have a whole different group of clientele and they could source out who it is and make that match. And I think it'd really build out some of your desires.
we might want to think about that if that's something that.
Yeah, I think that's a very interesting idea. Absolutely.
To the extent that anyone finds that useful for anyone you serve, please send them there today. It's available. And we're building that up. The other thing that's going to be available by August is Launch for Employers. This is a very employer-centric view. which employers can be getting benefit from launch today, the same way they have through other means. That it's, residents are coming to them. They can find the jobs, they can come to the employer. This allows the employer to go the other way. An employer can go in, set up a job role, very skills based, so it's not just text string matching on a job rec. And then they can search the pool of candidates who are, there's an opt-in out, like who are opted in to being searched. They see de-identified, no demographic identifiers or anything, just they see individuals with skills, and they can kind of go in and they see if they're interested, they see the skills match. The employer can say, these are the skills I require, these are the skills I'm willing to train for, maybe get connected with a provider, an apprenticeship, something like that for the trainable skills. And then go into sort of a resume view that's standardized, it's anonymized, it's really just looking at someone by their skills, what they can do, including if it was a self-attested or if it's been verified, if it's been validated through ACT or a work key certificate in CRC, a post-secondary certificate, things like that. If they choose to connects to a candidate, there's a message there. They can put that message in. The potential candidate could receive an email, get a notification to the system, and that's kind of a Match.com sort of paradigm where then the potential candidate sees, hey, here's Walmart has this job, they're interested in maybe inviting you to apply, and you can ignore it. It's up to you, or if you choose, you can then apply for the job. So the employer never sees information about the individual unless the individual opts in a test. And so that's a way to facilitate skills-based employment and just really kind of allowing the individuals on the platform, particularly if we're giving them verified credentials and things, to stand out and be found by skills. Anything else on that before we?
There's so much to say, and I don't know what's relevant because you're hearing from a lot of different directions of how this could impact Arkansans. We anticipate this time next year that we can say every high school graduate has a profile in this system. Every reentry Department of Corrections has a profile in this system. If they're receiving state services in certain components, whether we integrate with Hope Hub or Care Portal or other NGOs, to build out the case management side, there's all different ways of bringing people to utilize this system to get what they need. So it becomes the kind of the Walmart of digital solutions for Arkansas services. But even more importantly than that, for me, is Arkansas needs to use it for our employment, for our growth, for how do we develop, career pathways for people, knowledge and awareness, exposure to different jobs. How do companies post positions, but also use this as a reference to say, for maybe the area agency on aging, I'm 55 plus, but I want to work part-time and I have some great interpersonal skills. Where can I go? And how do I start developing out repositories of employers that are either wanting military veterans, spouses, and families? We will guarantee an interview for an open position, or maybe second chance folks to say, my heart's really in second chance. Who are those folks that I could seek out to employ? Or maybe I'd really like a more mature group that could help me with tourism or culinary or some things of really high impact integration with the population that maybe some of the younger generation doesn't have today. But how can we develop out these repositories for employers to say, this is really the group that I find success with. I want to see them first and then show me who's out there. But we're utilizing, whether it's a LEARNS legislation or PROTECT or other parts of the governor and states initiatives, this is the solution that gets us to a place where job placement, how much they're making, and how long are they staying? What's the retention? It gives us a really good place to know which schools are turning out a graduate that leads to the employment. And are they making more money or less money in the time that they sought that out? So all of this is coming, and I hope to be able to share that information with you if we're invited back next year.
We do this isn't Mike's platform, this is our platform. I think this is all of our platform, and so we really want ideas, we need, it's a continuing roadmap, so we constantly want to know what can make it better.
Want your input.
The other piece is it's kind of, this is a little, it's related to launch. It's kind of a T because someone can go here and maybe never go to launch if they have a food insecurity barrier and maybe that right now, they're not looking for employment and training right now. But in part of the launch workflow after they get jobs, then they can hit this as the supportive wraparound. So they're very related, but we made sure that like, you can go into either door independently. So Civic Forum is just meant to support common discovery and intake to supportive services, state services, community-based services. We've heard in this very panel, I don't remember if it was Senator English or Senator Chesterfield, about a year ago, talking about like all these services that nobody knows about that go underutilized. Like how do we, connect people, make sure they can find these services, but also even our own state services. A lot of different services can be co-located in the same physical building and still have completely separate systems and people and processes. And it's not fun. And that's if you don't have various transportation or childcare or anything to even get there. So we wanted to make sure it was easier within a physical setting, but also that we gave everyone just 24/7, anytime, anywhere digital access. So we partnered with the Google Philanthropy, Google.org. They very generously over the past couple of years donated time from 16 Google Fellows who kind of roll over in cohorts. They've been working pro bono for the state. Doing this, they worked with the city of Seattle, who initially did this. It's a city, but it's the same population as the state of Arkansas. And we've really been working together with Seattle and now Miami-Dade County, Charlotte, North Carolina, Bloomington, Indiana, where it's really a civic tech movement where we can all add things and we're all growing together because we don't need to do lots of different versions of the same thing. So this is constantly evolving too. Also benefits from your ideas, but the way it works is someone can come log in and that they can fill out forms. We started with kind of a 12 question screener that we got down from about 170 questions that are currently used in the job centers that hit most of the barriers to economic independence, just to kind of filter it down. That can be added to, but most of the usual things are there. And then based on those answers, or they can just go right down to these program cards. It'll indicate you may qualify. This is not eligibility. We're screening at this point. Eligibility still happens in the case management systems. It'll kind of give them a little, this is what you may qualify for, visual indicators. These cards can be as lightweight as the address and hours of a food pantry in your area, just completely informational, a hyperlink, or it can be a full form. A lot of these programs are on Access or Google Sheets or paper, and so we also want to make sure that for smaller community-based programs that they've got a good place to take this in.
I want to comment just on a couple of things to say that because of federal dollars and revenue streams, we've been serving what I'd say fingers and toes, knees and elbows of Arkansans instead of a whole person. And they often don't know where to go to get that. So now I could put in here Chris Perry once, no matter what Chris is after, every form that he's looking at is going to be auto-populated with name, address, all the information that Chris is now nervous about, Big Brother watching him, and how that comes together. But it streamlines the process. And imagine the interviewer, imagine the case manager have to go back and do this all over again, time and time, even within one agency. We may see 7 different forms where the same information is filled out on paper. And the time of intake and the frustration of both parties is just exhausted. We've got to catch up to a point where now launch forward to AI, GPT. It's exciting to me because this has been a cost neutral for the state. The state hasn't spent money on this. It's been private donations. A lot of our employers and philanthropy thinks this could be a national thing. When Robert's talking about Civic Forum, there's not another state that's adopted it. This is very unique to Arkansas, and we're just getting started. And it's really exciting to see the bandwidth potential and collaboration of knowing what is important in your area of what we need to do, and then be able to serve that. Because I still go through as a constituent ARHOME and find launch. It's interoperable. So the AI or the API side of it, working on the background architecture still feeds each other, but there's all these different ways of getting to the same place. But now it's mapped and it's networked. Sorry, I couldn't help myself.
Yes, we detected that. It's got the little bar at the top, like Mike said. It's when you do forms, it's there's a question bank. So first name, once you fill in first name for you, it's filled out. You can pop it on 100 different forms. It's always going to be populated. When you change it, and it changes everywhere. So it saves time. In Seattle, it's gotten the average form down to 2 or 3 minutes, which here can take 60 minutes, 75 minutes 2 hours. We tried to set the text up so it's fifth grade reading level, it's understandable. It ties to the federal reporting and the things we need to do, but it's tailored for that user-centric language. It's multilingual, it's 508 compliant, it's English and Spanish now. We're working on the Marshallese translations and then the Burmese. We have it just as weeks ago tied into the Arkansas Geographic Information Office. So, it can help with address correction, also with surfacing locally relevant services. Since we are a state, if you're in Fayetteville, you don't want to be seeing maybe services in El Dorado. And then we can have helper text. If someone doesn't know what a displaced filmmaker is, we can do that. And as we were piloting the Hot Springs office, we were kind of paying attention to, okay, what were things that somebody maybe didn't understand that tripped them up?
If I'm in a position where I maybe have a digital literacy issue, access to broadband, maybe language or reading comprehension are my challenges, and I'm not sure how to navigate this system, I could do this in my front room. If I have the abilities, it's gonna be system agnostic, but I could go to a place like a workforce office or to a health, I could go to different organizations and click trusted intermediary. And the person who's helping me find services can take the driver's seat and be my digital tour guide to get me a resource and a service. And that way, as we start moving around as a state, it brings that visibility to a level of simplicity.
There are 5 different roles from just end user to administrator, but one is if you're running a program, it lets you very easily no code graphically manage your forms and put these little cards on, and they have pictures now. But also to go in and see your intake, to manage it, and for the bigger systems that have a dedicated case management system, they may never log into that because we set the form up, it pulls off via an API, and it just shows up in the state system of record like it's a referral, just like someone typed it. It shows up there. They didn't have to do the repetitive work. For a smaller program that doesn't have a giant system of record, like this can be a little mini system where they go in and pull it off when they need to. But there is a trusted intermediary role, and Seattle found that very beneficial, whether it's a digital literacy barrier or someone that's digital literate, but they are intimidated by government administrative forms, and there's a certain comfort level for someone who's filled this form out hundreds of times to kind of do it for them. So if Arkansas United Community Navigators, you want to assist somebody, they can have that role where they can do it on their behalf. It also has a secure document upload and things like that. So we're really just trying to make, not necessarily replace any current doors, but like just have one place where we can get as many resources as we can, and to encourage co-enrollment in these referrals. And we have, on the back end of this, we can run referral rules to look and see where co-enrollments are happening, where they're beneficial in terms of outcomes, that we might want to update our rules with evidence-based policy, or where we can kind of do additional referrals.
I want to mention the transformation. Prior to COVID, if I wanted unemployment insurance, I would have to go to a workforce office to get it. During COVID, it was a pivot to a call center. January 1st, it became released. I can do a call center or I can use Launch. And in that time, the numbers that Robert gave me, we've had 44,692 Arkansans have used the platform to submit 18,000 plus job applications with 975 users having placed, well, that's the number of users that was set. And then 430 of those users have made 1,528 interviews. So it's a lot of different pieces like that that's with a small population. And now we're ready from the pilot to the proof of concept to scale, but we want to do it successfully because we get one chance. Speed of trust says if I make a mistake with an employer, I'm not going to get a second chance. Same thing with a job seeker. So how do we soft launch this to a point where we develop sustainability? And so our answer to that was utilizing National Labor Exchange job postings, because employers aren't going to probably even realize that their jobs are being posted here, but they're public. Why wouldn't we leverage that? How do we increase that 17,000 positions to 34,000 for people that aren't utilizing that? So that's a lever to pull today. The other is building out the piece that gets released and public comment and communication. It goes out. It's kind of an organic opportunity, but the number is going to be multiplicative as we adopt this?
So launch for job seekers is ready to go. Civic Farm, right now, we're not ready to send residents to it. We're trying to get the programs there so that when someone comes, it's enough programs. So we're really looking for what programs should we expect to be there before we start directing residents.
Civic Farm.
We want to serve Arkansans that can't serve themselves. There's a group of folks, this room's example, we don't need the state's help, thank you. But what about the folks that, if I just had one thing fixed in my life, I could go get a job, and we saturate the market with those positions. Second one would be, I've got transportation and childcare. If I get those two things resolved, how do we start bringing this down to people that can truly see a future and a benefit from, the best, the work that would come out of this office is you can target the people who really need the help and not the ones that, if just give me the empowerment to help myself. And that's what the shift is for us, from a workforce strategy perspective.
Anybody have any questions for them? Yeah.
So how do you engage with the private or local services that are available? If someone wanted to, say, on the civic side, how would they engage with?
And they can, we have an administrator assigned to help people get on, or you can email me and I can put them in touch, but we're also, and one thing that Seattle did is it's kind of meta, but they just put a card on there and said, do you want to register as a service? So you fill it out to get in contact, but it's,
To help monitor, and then would you provide data and feedback to kind of govern like what resources they have available, how much resources they have? So if I were in a rural community and I wanted to offer a service or a benefit to some of the local businesses, and they can have access to the site, how could you provide reporting so it wouldn't be overpopulated or beyond their budget? Does that make sense?
Mhm. What you're describing for me is what I call Q2 FY25. It's on our radar. We have a plan, and we've got the next 4 years mapped of what that looks like with technology that exists. But the answer is what Christie's holding in her hand. It's the NGO piece. It's getting all the partners together. But we've got to get job seekers done, employers almost done, then launch for students done. Then it's going to be launch for community. And that's going to really unlock some of the potential of, let our churches and our civic organizations, the people who know their folks locally, already have relationships and can build that, but let the Arkansan find out who those resources are in one place, go get what I need. I used to eat scrubs and I could take a CNA class and this grant's going to pay for it. We've got to bring all that together, but that's kind of a future build that we have a lot of capabilities we're hoping to unlock in the next part of my boss's term.
So those are the conversations that I'm having currently with other partners like Care Portal. I don't know if you all are familiar with Care Portal, with Hope Hub, with Restore Hope's Hope Hub. And I've been carrying this diagram around for about a year now. And I have notes and names and all kinds of things, but creating a technology ecosystem for a connected community of care, in which launch is the pivotal part that provides the access to the state services and the community resources focused on workforce, but that's not the only, end all piece of it. It's the other state services. But then there's a case management aspect of it that Restore Hope and Hope Hub have a shared case management platform that's not unlike anything I've seen. And we're in conversations about how does that integrate with launch and with this effort. And then Care Portal is the faith-based community. It's a platform that allows churches to receive requests from a case manager who knows that, Robert, but for a bed, just needs a bed for his children to remain at home, safely at home. And that church can pick up that need through the Care Portal, fulfill it. But the idea with Care Portal is that church is interested, or the community organization, because they've expanded beyond just the faith-based partners, can form that relationship at the community level. So it's not a state level service that's being administered. It is happening organically at the community level. And then the other part of it that we're looking at is a healthcare navigation piece. Is how do we incorporate, and that, that could be something, that our healthcare partners can talk about, but there are different platforms that, and I'm not talking about finding healthcare resources, because there's lots of different, there's Find Help Now, which is also part of our conversation. They're engaged in these conversations. That is something that's more of a reminder and sort of navigation piece that's individual for the person. So like I'm, let's say I'm, 6 months pregnant. I'm not, for the record. But let's say I'm a woman who's 6 months pregnant and I have not gotten my first prenatal visit. It's something that you can access that says, hey, by the way, it's really good to get this earlier on, but you're at this point, this is the best recommendation for you to go follow up on these services. And so incorporating all of these into a connected ecosystem, launch being the first active part of this, is very exciting. But those are the conversations that are happening. Mike and Robert are in the lead on getting this activated for the workforce in the state. Civi forms piece of it, and then we're having conversations with other partners on this, and it's pretty exciting.
It's getting big enough now where we're having conversations like, how do I renew my car tax, pay my property taxes, get my fishing license renewed, have a background check established, and store my social security card so I can get my CDL. All these different things of one stop, one place to go, leveraging all of the state resources into that common platform that no matter if I came out of K-12 and ended up through a juvenile detention center, or how do I start to map out everything that I have just so I don't lose it in incarceration or in a fire or, the rapid response, all different parts of the state services. How do we create a digital platform that accelerates Arkansas?
Yeah.
This has implications for case management, case managers.
Oh,
What kind of vision do you have?
It'd be a share. It would be, there's a lot of kind of rules and regs and data, sharing agreements type, but what's unique about this system, as Robert's designed it, is it's state owned, it's state stored, it's login.gov secure. It has a lot of different safety features built into it. We want to be able to access other information. We don't necessarily want state personal information going out. So how do we develop that through, and might even be some legislation required of data sharing, but Robert's the expert on that side. The case management would be maybe as an Arkansan, I release that to Hope Hub, and Paul Chapman's organization has mentioned that. Well, then I go over to Goodwill and I'm being served through Goodwill and they have access to that information. So it's going to kind of create these breadcrumbs that allow me to say, this is where I'm at, this is where I want to go. How do I get there? Can I do it through apprenticeship? Can I do it through a couple of church organizations of build my physical needs, but then I want to get to a job, and it starts to map out this ecosystem, which is huge. And even though she's carried that around for years, she wouldn't say that part. It's because it took that long to respond. We weren't ready for that. We want to get jobs first. And so we're trying to build this out, but it's gotten enough support that it's really fascinating what this thing could become.
I kept saying, yes, workforce and jobs, but there are things keeping people from that. And that's the part where we come in. And so that was the vision piece that our team has had on this. And the case management implications, currently with Hope Hub, which is also unique to Arkansas. It's Arkansas owned, it was Arkansas built. And Restore Hope actually owns it, but everybody's working very collaboratively and sharing well together, because the end result of this for Arkansas and then beyond that is phenomenal for having that kind of a co-created system of care around people that they own and they govern, right? And so in Hope Hub right now, as it works, people have to consent to other individuals being able to see that, the different pieces of, so like, let's say you're Goodwill, Elizabeth is DHS, Robert is, I'm gonna make this up, the food bank, and I consent as an individual so that all three of you guys can see what's going on in each of those realms related to my family, to me and my family. And it's real time. It's got Tableau dashboards that update, that allow, if I missed my appointment at the food bank, you'll be able to see that at Goodwill and go, is everything okay? So it's one of those interactive, again, consent driven, but it puts the individual in the driver's seat of empowering them.
It sounds a lot, this is going to be, I'm a lot fanatic. Sounds like Revelation 13:6 to me. And I don't want to have all this data about somebody just floating around out there in a government agency, because that concerns me. So empowering the Arkansas, I want to release this, or I don't. And giving them the option, instead of just saying, well, your information is going out there, because the trust is so important. We want to be private, we want to be protective. We don't want, if it's not something that they want to pull a lever on, then we don't want that. So we want to give them the options. Here it is. Use as much or little of as you want to.
It's making the data less program centric and more individual centric, and giving the individual more self-sovereign access and control.
You mentioned a comment about a referral program. Would it offer personalized referrals for different state-based programs such as WIC, like you're pregnant, you're eligible for WIC, or looks like you have a job that qualify for that type of AI supported engagement?
Yes, that is absolutely the intent, and it can be multi-layered. The rules do civic form are fairly deterministic. It's you check this, you should get that. As we get into things where we're looking at, like household composition and recovery level, if there may be a deeper layer because we have a business rules engine that can handle those types of things, or if we need to go and check and see if like career pathways initiative that you have deterministic eligibility based on like SNAP or TANF. We can handle the easy stuff in civic form, and then we've got a deeper layer that can handle more robust rules.
Any other questions? Any questions online? Very, very much. Very excited about what you're doing and how it connects to what we're doing.
Yeah, we get to do it together.
Yeah, I know.
Imagine that.
And I'd be remiss if I didn't mention the Walmart Foundation provide a lot of generous support for providing, funding the development and everything on this at no cost state. So again, it's like buy Arkansas for. So.
So we are next going into a public forum. This is a requirement of our waiver. You guys are welcome to stick around or not.
Parking time is up. I talk too much.
Imagine everybody has the same parking time.
I'll go put quarters in, everybody, if I see it expire.
Fascinating. I've put all kinds of secrets in there. No, I'm not. But we will tell CMS that the attendance will be. But that's up next. And then we'll have a meeting in September, as we normally do. We don't say the location yet. We will be deep into health outcomes, so that should be a jam-packed meeting. And we will have the results of the QHP incentives. I think set a July 21st deadline for those. So there'll be what we just saw for economic independence incentives. We'll be seeing the results of the incentives that they offered. Welcome to come back and join us for all of that.
Closing remarks. I don't know that I have anything more to close with, just the excitement that we have. Again, I've been saying for a long time, years, Robert definitely heard back in 2021, part of our biggest challenge as a country, has been in the way that we serve our people through our human services and other state agencies. Our children and families don't come to us in pieces, and yet we are required to plan and budget for them as if they do. And that's, federal, state, all kinds of requirements. I think the exciting thing about the work that's being done collectively by this group and with the workforce team and Robert and crew is we're just trying to think beyond boundaries. We're trying to think beyond funding streams and we're excited to have all of you, joining us on that. But this really is an ARHOME, the original intent of ARHOME, it speaks to serving that whole person and making sure that wherever there's a need, regardless of whether it's specific health need or it's an ancillary social need, it's not so ancillary, it's all part of that person. So, again, just appreciate everybody coming to these meetings, contributing, continuing to work really hard at things that sometimes seem like they're they're not improving. They really, they really are, because we're having these kinds of conversations. So, just appreciate those efforts.
Well, thank you all, and I'm going to start in on the public forum, but you guys, you can leave about the cabin. As I.
We don't anticipate any rough air.
I don't. For those who are staying on, we're going to get into the annual public forum. Some people in here, again, feel free to, you don't have to, I'm not going to take offense to people moving around and leaving. But it's in the big public forum. So the purpose of this public forum is that we operate as a Section 1115 demonstration waiver, and our federal waiver regulations require a post-award public forum to solicit comments on the progress of our demonstration. And this forum gives the public an opportunity to provide comments, inputs, all of that. The forum summary will be included in our quarterly and annual, thank you guys for coming, quarterly and annual reports at CMS. And all the forum materials will be available online at our ARHOME advisory panel information webpage. Just as an overview about ARHOME, it is our Medicaid expansion program under the Federal Affordable Care Act. It serves adults between 19 and 64 years old with household income below 138% of the federal poverty level. It was established as a Medicaid waiver program so that we could do our expansion program a little differently than the way it is set out in federal statute. Our waiver allows us to spend Medicaid dollars to buy private health insurance for our clients. The federal government pays 90%, which is a higher match rate than some of our other Medicaid programs. Arkansas pays just 10%. So it draws a lot of federal dollars to the state. Calendar year 2023 expenditures totaled $2.4 billion. So it's a very large program. So our current ARHOME population, we have about 238,000 people currently enrolled in ARHOME. That's about 13% of Arkansas's non-elderly adult population are in our ARHOME program. About 55% of ARHOME enrollees are women, 46%, 45% are men. There was a rounding issue there. And about 67% are 45 years or younger, so it does lean among our younger population. About 45% are less than 20% FPL, and 20% are greater than 100% FPL, so it also skews to the lower FPL groups. This is a public forum, so we treat this as sort of what are the big things that have happened in the previous year or that are currently happening. In 23, the big event was the end of the public health emergency. That was during COVID. The federal government required us to continue to keep people enrolled in Medicaid, except in certain circumstances. For example, if they moved out of state, we could disenroll them, but there were very few exceptions. So we maintained our enrollment from March of 2020 through the end of March of 2023. The federal government said April 1 is the end date for continuous enrollment, and Act 780, the Arkansas Act 780 of 2021 required that all Medicaid eligibility redeterminations, all the redeterminations which are required before you can continue eligibility or disenroll somebody, those redeterminations were to happen within 6 months of the end of the PHE. So that was September of 2023. This is if you've been on since the beginning, you will know that this graph shows the disenrollments and our current, what has happened with our enrollment overall since the end of the PHE beginning in April. We had a precipitous drop in those months, but it has leveled off. We've decreased from the height of our home enrollment by about 32%. We're now at about 238,000. We're losing people now at about 1 or 2% each month. So it has leveled off.
Now, as you keep that slide up for a moment, could I just mention, again, one of the unique things about Arkansas in that as individuals left Medicaid, and in many respects, as the economy improved, family income went up, et cetera, people were able, who were in a qualified health plan, stayed in a qualified health plan. They kept their same doctor, they kept their same coverage, and really had that seamless transition, where in other states, that disruption, they had to start all over again. So again, I think ARHOME is unique in that respect because we use the qualified health plans to provide coverage.
And Centene.
You can hear me, the audio in the room cut out.
We can't hear you guys anymore.
You all here now?
Yeah, you're back. I can hear you.
You. Okay, so I was saying this is all the instructions for renewal for ARHOME, also eligibility or any Medicaid program. Additionally, if you have lost healthcare coverage because you've exceeded the income limit, we would encourage you to visit the marketplace and join up with Centene or Blue Cross plan, preferably the one that you were in before. This is the slide we looked at earlier about a new ARHOME QHP that came on in 24. Blue Cross Blue Shield now has 3 QHPs, and Centene also has 3 QHPs. The new one for Blue Cross is Octave, and they now have about 7% of the total population. So our home, primary focus is health improvement. So health plans are required to provide incentives to their members or to providers to encourage health improvement activities. The QHPs submit annual quality assessment and performance improvement strategic plans, and they have to meet annual targets that we set for the quality of care measures. DHS may assess penalties if targets are not met. We actually, in the first year of doing this, we assessed a corrective action plan that the QHPs are under now, and we will assess penalties beginning with the outcomes of the 2023 health metrics. So the most recent metrics are available at the link, which we again will have on our website. We'll have this PowerPoint on the website with the link there. This is an overall, 22 was the first year that we set quality metrics and targets and had data to review outcomes. We'll review the 23 outcomes in September. But you can see that all of the QHPs met the established 2022 targets for readmission rate, hospital readmission rates, follow-up after an ED visit for substance abuse, an asthma medication ratio, use of pharmacology for opioid use disorder, use of opioids at high dosages. And most of the QHPs met the 2022 targets for engagement in substance use disorder treatment. That is, there's 2 stages of substance use disorder treatment. One is initial, and then the other is engagement. And this is, I believe, after 60 or 90 days, are they still in substance use treatment? Then most QHPs also met the 2022 target for concurrent use of opioids and benzodiazepines. That's a measure that where lower is better. So they were meeting the lower standard. These are targets that the QHPs did not meet. No QHPs met the 2022 targets for cervical cancer and breast cancer screening, contraceptive care for postpartum women. We have 2 metrics. One is for postpartum women, one is for all women, and neither one was met. Hospital admission rates for heart failure. There you saw earlier they all met hospital admission rates for other types of conditions, but not for heart failure. Follow-up after an ED visit for mental illness within 30 days. That's a follow-up visit within 30 days. And then follow-up after hospitalization for mental illness within 30 days. Also, they met the target for adherence to medications for beneficiaries with schizophrenia. And most QHPs they did not meet for adherence to medications for beneficiaries with schizophrenia. And most did not meet the target for chlamydia screening or antidepressant medication management in the continuation phase. And again, that's broken into 2 different phases, acute and then the continuation phase. That measure is 2 different measures. And then we had mixed results for hospital admission rates for diabetes for short-term complications, initiation of substance use disorder treatment, antidepressant medication management, the acute phase, and then diabetes screening for people using antipsychotic. So we had a lot of activity on Life 360 homes recently and in 2023. But just as a reminder, the concept of a Life 360 home is that DHS contracts with hospitals to provide or contract to provide intensive care coordination for our home enrollees who are most at risk. And there are 3 types of Life 360 homes. we're gonna just talk about, there's three: maternal, rural, and success. We've had a lot of activity in the maternal, Life 360 home. So that's the one that we'll be talking more about. Rural Life 360 homes is care coordination services. The hospitals would be providing care coordination services to individuals with serious mental illness or substance abuse disorders who are living in rural areas. And then Success Life 360 homes would help individuals with life skills and social related health needs for young adults who are most at risk, adults who are in their 20s. Most. So, but we'll talk about maternal Life 360 because that's again where we've had the most activity. The maternal Life 360 home is a Life 360 hospital that contracts with an evidence-based home visiting provider to provide home visiting services to women with high-risk pregnancies. The home visiting program provides services to women with high-risk pregnancies who live in the service area of the hospital. The hospital has to be one that serves, that has an obstetrics unit and provides birthing services. And the woman will receive, they start receiving home visiting services while they're pregnant and receive home visiting services through 2 years after the birth of the baby. If the woman is enrolled in our home, if she's not enrolled in our home, she's in another Medicaid program, she would receive ongoing services after the birth for 1 year. That's that's not CMS approval pending anymore. They have approved that. Our home beneficiaries can continue to receive these home visiting services. If they're enrolled in the services, they can continue receiving services even if they disenroll from Medicaid. And that's only available to the women who are in our home, not the women who are in other Medicaid. So we're identifying the providers. This is our experience thus far. We've approved 2 applications and we're reviewing 2 other applications. The 2 applications that we've approved are not approved, excuse me, yes, sorry. 2 applications that we've approved are St. Bernard's in Jonesboro and White River in Batesville. We've executed those 2 startup agreements, and we actually conducted our first readiness review visit to St. Bernard's on June 17th. It was a very good visit. We are in the process of reviewing all of the binders of information. They were very organized and gave us lots of information, wonderful, very organized program. We're reviewing all of that information now to make sure that they've hit all of the things that we require in the readiness review and hope to get them up and running very soon. We've so far those are the ones that have gotten to the application stage. We've also, including those 4 that have submitted applications, we've approved a total of 10 letters of intent from hospitals. That's the first step in the application process. They just send us a letter saying we want to participate, and this is how we're thinking about doing that. 9 of those were for maternal and 1 was for rural. We had 1 hospital that decided not to move forward. We had another hospital that initially decided not to move forward, but now has resubmitted. So we're very excited about that. The hospitals that we're talking about are partnering with existing home visiting programs, but others are starting new programs, new home visiting programs to the state, some that haven't been here before. And there's some of them are using planning to use their own staff. And then the counties that we are talking about include Craighead, Pulaski, Saline, Independence, Faulkner, Washington. Very excited about that. We hope to have an update maybe in our September meeting of go live. So other updates and approvals for Life 360 Home. We've completed our billing system changes that allows for enrollment into the Life 360 homes, the hospitals and the beneficiaries. That happened in 23. We created a Life 360 web page, which you can see there. We've amended our beneficiary provider relations contract with AFMC to add support for the Life 360 home providers to help them enroll beneficiaries and set up a call center for the program. And then CMS recently approved our state plan amendment to allow not just ARHOME women to participate in the maternal Life 360 home, but any high-risk pregnancy, high-risk woman with high-risk pregnancy in any Medicaid program. We're hoping to post that for public comment soon, and it will go through the promulgation process. And then we also have a number of other waiver deliverables that CMS has required of us. There were 3 or 4 reports that we needed to complete. We've done that, and those are under review at CMS now. We've also we have developed an evaluation plan, again, part of the 1115 waiver that we have. We have to do an evaluation of the program. We've submitted that evaluation plan to CMS as well. There we go. So the whole purpose of this is to allow for comments and questions, input from the public. These are all the ways that you can submit comments and questions. You can also right now unmute yourself and ask any question that you might have. So I would invite anyone who wants to make a comment or has a question or wants to say hi. Anyone in the room? If you have something, if you think of something later, please feel free to submit. You can mail me or you can email me. These are other contact people that you can contact. Elizabeth is our director, me, and then Nancy Watson is our our Life 360 home program manager. We could not live without. And if you have a Life 360 question, please feel free to reach out to her. Oh. Hospital that submitted a letter of intent for the rural Life 360 home program be the first. Yes, we have one letter of intent and for a rural Life 360 home. So if we were to approve that, that would be the first. Any other questions? Thank you very much for attending, and appreciate the person who asked the question. That makes it a little more interesting. I think that wraps up our presentation, and we'll let everybody get on out of here.
Thanks, everyone.
Thank you.